officials, and my allies in the fight to prevent overdoses and save lives. My name is, as I said, Jerome Sanchez, and I work with New York Harm Reduction Educators, or NYHRE. I've worked with this organization for about 7 years and lost many friends and co-workers to overdose during that time. Part of my job is to train people, active drug users, and those affected by active drug use, and how to use naloxone and how to respond to an overdose. In the past year, 273 people have come to NYHRE for training and left with a naloxone kit and the knowledge of how to use it to save a life. I started in this field, started doing this work because I care about helping people to help themselves. Usually after a training, I get feedback from the participants, and they express to me how empowered they are and inspired they are to take care of themselves and to take care of others. As a result of my work and the hard work of my colleagues, we've had 19 people come back and tell us how they have used their training to save the life of someone they love and care about just this year alone. That's 19 human beings with families, friends, co-workers, and lovers. I'm proud to say that there are 19 people alive today because we have given out naloxone and information. Who knows how many of the people that we have lost would be alive today if we were able to give out thousands of kids instead of hundreds. The legislature has seen the power of naloxone and the power of the training to save lives. I'm happy that we have seen the passage of the 911 Good Samaritan Law, which provides some protection from prosecution for people who are seeking help in the case of an overdose. Everyone here has worked tirelessly to pass this law. I thank you. But I would like to see, and we would like to see this law go further. Now, we know what the police are supposed to do, but we need to make sure that Commissioner Kelly and Mayor Bloomberg ensure that the police don't arrest anyone for possession when they call 911 for help. We need to expand this law to protect people from ACS and NYHRE. We need to remove the barriers to the distribution of naloxone, because currently we need a medical provider to sign off on a prescription. There are no adverse side effects to naloxone. There are no records of abuse. Naloxone is safe and serves only one purpose: to save a life from overdose. We need to remove these barriers so naloxone can get into the hands of everyone who has a prescription for narcotic medication or narcotic drug, anyone who uses narcotics recreationally, and the family and friends. Every overdose is a missed opportunity and a lost life. We're gathered here today to remember our loved ones who are no longer with us. I remember friends, and I missed them, and I hope they're in a better place. And I'm also mad. I'm mad that no one was able to save them, possibly because they were afraid to call for help, or they were unable to get access to naloxone. Now, we've trained many people who have told us that if only they had been able to get the training earlier, they may have, or some other time, they may have been able to save the life of someone that they've lost. Now, we can't save the life or save those that we're here to commemorate today. But we, and I envision a city, New York City, where we are able to use every available resource to save lives. Preventing overdoses saves lives. We need to expand our Good Samaritan law and ensure that no one has any reason to fear calling for help, and that everyone who wants naloxone training is able to get it. Thank you.